Hi everyone, this is Meha Patel. Today I'm going to discuss about the given scenario for this week um, for the CEO of the small company who is handling the trial in a phase 2 for the antiviral drug, which has a pretty promising results. However, the study is still considered in the early phase. The media has asked the CEO whether he or she would let the company release the antiviral drug in the market or not. As a CEO, would I support this notion or not? As a CEO, I would definitely not support this notion. So, the first and most important aspect of the clinical research is getting more data, getting more data for the safety and efficacy of any new drug or treatment coming to the market. So first and most important thing I see here is incomplete trial. I would not leave any trial incomplete and not like to release the drug or any treatment to the society. Second, this will create a very huge safety concern to the population. And looking for the safety of the public is the main target and factor of the any pharma company, and this is totally against the goal of the any pharma company or clinical trial. Third, any trial which is in phase 2, that means it's getting compared against the dosage comparisons or finding out about the side effects of this drug. So that is pretty good level to find out about the desired dose and the side effects of any drug. However, the very important part of any study design is a randomization. In this study, if it's in phase 2, we haven't reached the randomization because randomization is normally getting done in the phase 3 trial, where we can collect more data and also randomization and phase 3 trial can help us find out about the efficacy of the drug and also the survival rate after using any drug. How would be the patient's survival rate? So phase 2 targets the treatment using the drug and the dosage, and phase 3 is very important finding out about the survival, which we are missing in this case. We haven't reached that level yet. So the other important aspect, the fourth one, is a financial aspect. Any pharma company who's doing the clinical research are putting lots of efforts and it's a huge financial commitment. If you're leaving the trial without completing and also publishing the drug immaturely, there are very high chances of being unsuccessful, and at the same time all efforts and funds can get wasted. So this ultimately creates a huge financial burden for the pharma company. As a CEO, I would not definitely want that either. And this can lead to high cost and low success rate for the drug as well. The other most important part, number 6, is the regulatory. Any regulatory would not like to move forward without having enough data collected by the clinical trial team. And the last but not the least is unethical. This is unethical that not having enough data and efficacy and safety reports for this drug or treatment we are releasing to our market. It's a huge medical threat to our population and society. So as a CEO, I have to look for so many aspects, ethical aspects, companies' reputation also, and the safety for my population. So I would not leave my trial incomplete, and I would not release any drug in a phase 2.